You are welcome to my channel. Today I'll be talking about COVID-19 long-term effects. You must have heard about long haulers, right? Today I'll be addressing that fully. By way of definition, the long haulers are the people familiar with us who were once diagnosed with COVID-19, treated, recovered, and now battling with many COVID-19 related signs and symptoms. They are not in the hospital, so we should not think long haulers is about people who are in the hospital being treated for 2 weeks, 3 weeks. No, they've been discharged, okay? But some of them did not even get up to the level of being admitted into the hospital. Some just had mild cases, but got out of the wood. However, you can tell today that their lives have changed over certain period of time, ranging from 1 to 3 months, and sometimes even more. There are certain possibilities when it comes to COVID-19 infection. I will not waste your time going into details of each of them here because that has been done in the past and already published. You can check my channel for COVID-19 signs and symptoms. There you're going to find detailed explanation on asymptomatic COVID-19, symptomatic that could be mild, severe, or critical, and of course, fatality, that is those that will die, and those that won't die will actually recover, and after recovery, they'll be faced with a lot of things. So they'll be dealing with persistent symptoms. Who are the long haulers? Well, basically, someone has been diagnosed with COVID-19, right? He or she has been treated or just been monitored, and then recovery had occurred, and the doctor had told him or her, "You're fine to go." Now, after weeks and months at home or wherever, the individual is still having persistent signs and symptoms. This phenomenon has different names, like long haulers, long COVID-19, post-COVID-19 syndrome, or post-acute sequelae of SARS-CoV-2. SARS-CoV-2 is the name of the virus responsible for COVID-19. How can we make diagnosis of long haulers, if at all there's any diagnosis to be made? Well, it is based on reports from the treated COVID-19 patients who have reported back to their physicians. Research is still ongoing as per the cause or the basis of the massive viral effects on many organs and the lasting symptoms after recovery. So research is still ongoing, okay? More will still come, but we should remember some diseases that can affect all organs in the body, like tuberculosis, like diabetes mellitus, and so on. So COVID-19 is falling into that category right now. The long haulers, they may have mild or severe cases or be diagnosed with mild cases initially or with severe cases initially. It doesn't matter. There is no consideration for hospitalization. Let me explain. It's not that because Mr. A was diagnosed with COVID-19, was intubated in the hospital, was there for 1 week or 2 weeks, that is why he has come down with persistent symptoms right now. No. Even those who had never been admitted into the hospital, who had mild symptoms, could join the group of long haulers. No age predilection, so it doesn't mean elderly people will be the ones that will have long-term effects or will be having persistent symptoms even after recovery. No, it doesn't mean that. and there's no consideration for comorbidity or morbidity. So healthy people will have it, non-healthy people will have it, people with comorbidities will have it, people without comorbidities can have persistent symptoms after recovery. The most common signs and symptoms of long hauler or long COVID-19 will be cough, chest tightness or chest pain, shortness of breath, myalgias or arthralgia, that is joint pain and body pain, okay, and of course fatigue. Other symptoms that could be present but not very common would be anosmia, that is lack of sense of smell, dysgeusia or parageusia, bad taste. Someone who's a food taster now with COVID-19 won't be able to do the job. Cognitive impairment, dyspnea, diarrhea, persistent fever, hair loss, difficulty sleeping, rashes or palpitations. COVID-19 related chronic diseases. Okay, I'm going to go through this so that we'll know that anyone diagnosed with COVID-19, treated and discharged home, may in future be done with some chronic diseases like heart failure, stroke, seizures, dementia, Parkinson's disease, renal failure, hepatitis, and liver failure. Central nervous system could be affected in many ways, and the neuro complications here will include ataxia, seizures, encephalopathy, stroke, meningoencephalitis, movement disorder, motor deficit. Still on central nervous system, there may be sensory deficit, vertigo, Guillain-Barré syndrome within 1 to 2 weeks post-infection, and cognitive impairment. And with that, there will be memory impairment, poor concentration, and diminished attention span, meaning that the affected person will find it difficult calculating stuff, following orders, and co-workers, family members will notice that. When it comes to the heart or cardiovascular system, there may be arrhythmia, decreased ventricular ejection fraction, then the person will be feeling dizzy and falling down, myocardial infarction or heart attack, heart failure like I've said earlier, palpitations, and myocarditis because of inflammation affecting the myocardium. The lungs may not be spared. There may be pulmonary fibrosis, pulmonary embolism from clotting problems, abnormal pulmonary function test, dysfunctional breathing, and secondary infection by fungus like aspergillus, and of course cytomegalovirus infections. The clotting problem now. Here, there will be likelihood of increased thromboembolic events, and these will affect either the large or small vessels. And it's not limited to arteria because it could affect both arteria and venous. So, venous thromboembolism, meaning there will be DVT or pulmonary embolism, the individual will, because of that, come down with stroke or heart attack. So, you can have a clue that that is ongoing when you have your D-dimer acid and it is raised. When it comes to chronic fatigue associated with long-term effects of COVID-19, that will be characterized with extreme fatigue, mental fatigue, physical fatigue, and when you try to rest to resolve it, no, that won't solve the problem. So resting is not going to solve the problem. The differential diagnosis of that could be ME, that is myalgic encephalomyelitis, or COVID-19 infection, or chronic fatigue syndrome. When it comes to renal system or kidney, There will likely be acute kidney injury or acute renal failure. The hepatic system will be dealing with hepatitis. And the liver failure, when that occurs, of course, there will be problem with protein metabolism, drug metabolism, clotting factors, because all clotting factors are produced in the liver except two. And the two that will not be produced there will be factor 8 and von Willebrand factor. So there will be massive bleeding when there is liver failure. There will be itching, and of course from the accumulation of the bile salt, right? And hepatic encephalopathy is likely going to occur as well. The psychiatric world will not be exempted from the effects of COVID-19, post-traumatic stress disorder, because when patients are admitted into the hospital and they hook all sorts of gadgets in them with so many restrictions, nobody could visit, they cannot hug, they cannot do this and that. When they remember that after, they have sort of fear and they could become depressed. So why is my life not turning upside down, restricted, limited? Anxiety, am I going to die? And of course, changes in mood. Now, job issues. The inability to focus or complete tasks in a timely manner can lead to a lot of consequences. For example, a lot of job error, loss of productivity, right? Legal problems for the establishment. When you make mistakes, like a banker, making mistake writing the wrong figures, 1,000, and then writing 100,000, or health professionals giving wrong medication, wrong dosage, and so on. Legal problems would then follow. Loss of lives, particularly in health field or transport ministries, like bus driver taking kids to school, or people boarding plane and the pilots would not pay attention, the plane crashing, or sailor, the cruise ships, and so on. Musculoskeletal system, there could be swelling hands, swollen feet, lymphadenopathy, and rashes. Research. Truth be told, anyways, we don't really know why this is so. We don't know why people who are recovered will still be having persistent symptoms. So research is still ongoing. As death is possible, so full recovery is also possible, but long haulers can be anyone, can be healthy people who acquire COVID-19 or someone with comorbidity, can be young or old, can be any level of severity, could be anyone with mild COVID-19 or those with severe or critical, okay? And there may be lifelong diseases after. Well, we will know in full in the nearest future. To prevent ourselves from contracting COVID-19, if you haven't taken your full vaccination, then continue with your face mask, your hand washing, avoid enclosure with non-masked friends and acquaintances, then continue with physical and social distancing, no loud speaking, and don't stand close to someone that is too loud, and no group singing. I've given some examples why presenting COVID-19 signs and symptoms. You can check my channel here for that. In conclusion, take the vaccine, please. Prevention, they say, is cheaper than cure. Observe all the preventive measures as well. And why would the vaccine be so important? Well, I cannot overemphasize the importance of the vaccination here. either Pfizer, Moderna, J&J, or AstraZeneca. Just get one that is available in your country, because that will prevent the devastating effects of this horrible virus. And to long haulers, if you have not received the vaccine, you are not helping yourself, because 50% of long haulers who have received the vaccine, they have testified to the fact that they were getting out of the symptoms, or their situation became better. So if you want yours to be better, get the vaccine, please. Then continue to observe all the preventive measures if you have not been vaccinated, please. With that, I've come to the end of this presentation. You can check my channel for the full presentation of signs and symptoms of COVID-19. Then combining with this, you should be able to have your way as per what is obtainable. Please remember to share this with all your friends. Remember to subscribe to my channel. I appreciate that.